here today with Dr. Sasha High. Welcome, Sasha.
Thank you. Thanks for having me.
I'm so excited to talk to you today. All things seem to be talking about GLP-1 and weight loss, and now hormone therapy and GLP-1. And so I think it's so important, though, to just take a step back and really think about all of the constructs that go into our weight, whether they be personal experiences, culture, things that other people have told us about our body weight. And so, what does empowered weight loss mean to you?
Yeah, I think empowered weight loss really means shifting from that kind of shame and guilt and external pressure and like punishment model of weight loss that toxic diet culture has kind of enforced over the past many decades, and moving into agency and self-leadership and caring for our bodies. And
Mhm.
ironically, it's really not about weight loss so much. Like, it's really not about chasing a number on the scale. It's about understanding your body, using evidence-based tools, and making choices that align with your values and your long-term health. And that's really what I talk to my patients and my clients about, is how do we shift your focus from the scale being this thing that rules over you and dictates your emotional
Mhm.
well-being from day to
Mhm.
day,
Mhm.
to you feeling really great about caring for your body and making those choices each day. So a lot less about weight, a lot more about health and well-being and self-care.
Well, and I find it's a very interesting space in that, you know, growing up in the generation of no fat, skinny models, and, that stick of thin is what is attractive and desired. But now I notice this emergence of a dichotomy among the menopausal demographic where it's like, don't have shame about your weight, love it no matter what, versus like a camp of, get thin. And I guess my point is that you can love your body, but still recognize that you're not healthy and
Mhm.
want to lose weight. And I wonder your thoughts, because when I look at it sometimes from the outside, I feel like there's no flexibility or no space for women to sort of be in that middle, because life is gray. And so to be like, I do love myself, but I would like to lose weight.
Yeah, I think you framed it really well. I think the whole body positivity movement is really helpful in many ways. And we can love ourselves and also want to be improving our health, right?
Hmm.
And if part of that means losing fat tissue because you just have too much fat tissue on the body and it's causing problems with your health or inflammation or all the metabolic diseases that are associated with excess adiposity, that it doesn't mean you're hating on your body. It just means you're caring for your health. And so I think that, like, I agree, there's kind of this move towards body positivity where it's like you shouldn't want to lose weight at all. You
Hmm.
should just accept
Hmm.
all of it. And I don't think that's necessarily healthy either. I think we need to look at the gray, as you just said.
Yeah, and I struggle in two ways. One is getting education out to women, because if it sort of can be framed in more of a health perspective, it might not get as much views or likes. If it's framed in a weight loss perspective, it does, but it's going to get some reaction from different camps. And so, um, what are your thoughts on blending the message in what you do so that it lands with people? Um, and they open their mindset to start to change.
Yeah, it's such a good point. Weight loss is like clickbait, right? Like when you're trying to get your message out, you have to think about what are people searching for?
Hmm.
It's like
Hmm.
marketing 101. And if even if you shift it to like weight management or healthy weight, you're just not get as many, you don't get as many
Hmm.
clicks. So you kind of, language is interesting that way, right? You kind of have to use the language that draws people in and then do all that work to educate them on why the scale isn't actually what you're searching for, because people think that
Hmm.
that's the be all end all. And that's, I think, our responsibility in healthcare and in empowering women, right? Which is the space that we share. Is, yes, we may need to use that language to bring people in because that's what attracted to, thinking that they're what they're wanting. But then there's so much work in educating them that like your worth is so much beyond your weight, and health can look very different. And yes, sometimes weight loss is part of that, and other times there's need for body acceptance and just working
Mhm.
on your healthiest lifestyle. Like there's so much nuance to it, right? And that's the
Yeah.
tricky part when you have 60 seconds to do an Instagram reel and people are just searching for weight loss. It's so challenging. And so there's a lot of work that we need to do in that education. I always frame it as no matter what your body shape or size, we all need to be working on health, because health is not the
Mhm.
default as we age, right? The default as we age, if we kind of just go along with the cultural standard and the status quo, it's increase sedentariness, it's alcohol consumption, not valuing sleep, not managing stress, and overconsumption of food, right? Like that's just the
Yeah.
direction of society.
Yeah.
And so,
100%.
regardless of your body shape or size, you need to be intentional about your health. Otherwise, you kind of invite all of the chronic diseases that we see. There's so much associated with lifestyle as a risk factor.
And as we hit, our 30s and start to have some muscle loss, some bone loss kind of creeping in and then into perimenopause, what are the things that happen to our body from a biological, physiological perspective that make us more susceptible to gaining fat weight?
Mhm. Well, we know that with kind of midlife, that menopause transition, one big factor is the decline in estrogen levels. And what that does is it changes where we store fat on the body. So, where premenopausal women might be more curvy and they store fat on their hips and their thighs, and they may not like that, but it doesn't lead to heart disease, right? It's kind of
Hmm.
cardioprotective. As we go through the menopause transition, now we have more of that central adiposity, i.e., fat on our bellies. And that is what leads to the concerns that we see, which is heart disease and all the other cardiometabolic diseases that come with menopause. And so there's that aspect of things. There's the shifts in insulin sensitivity as well. So women tend to be more insulin resistant as they go through the menopause transition. And then you referred to such a big one, right? There's like the hormonal changes, which are a piece of it, but so much of it is that we aren't moving as much. We're slowing down
Hmm.
with aging, and we don't have enough muscle in our bodies, right? Women traditionally, it was all cardio, cardio, cardio. Don't get bulky, don't put muscle on. And that is to our detriment, because muscle is our first line of defense against insulin resistance. Like it's such an important organ. And so that low muscle mass to begin with, and then throw in aging and the dropping muscle mass leads to more metabolic disease. Then there's all the other factors of menopause, like sleep difficulties and
Yeah.
stress reactivity, and that can affect all of our appetite hormones. So it's a lot of these changes that make weight loss harder, but it's really important that we know it's not inevitable and it's not impossible either.
And you explain that cycle of we eat, a simpler carbohydrate or how the body reacts to carbohydrates coming into our body and what that cycle looks like, including like GLP-1 in that process.
For sure. So when we eat, our body breaks down what we're eating into the macronutrients. So if we're eating a high glycemic index food, which means that it is primarily a simple carbohydrate, we're going to get a rapid rise in our blood sugar as that's absorbed into the bloodstream. Our body needs to deal with that. So it can't kind of sit around and let our blood sugar levels be really high. That would be detrimental to blood vessels and all the other things. And so we have our pancreas, which is very capable of producing insulin. So it secretes insulin. Insulin's job is to open up the doors for glucose or blood sugar to move from our bloodstream into our cells where it can be used. And so that is great. But as we, over time, if we kind of have like these chronically high levels of glucose because of dietary choices, like I'm talking over, decades kind of thing,
Hmm.
we call it, well, if we have chronically high levels of glucose, then we get chronically high levels into insulin. So that's called hyperinsulinemia. And eventually the cells kind of get really used to this loud noise of insulin. And so they start kind of I like the analogy of like they plug their ears a little bit. So the cells are
Yeah.
no longer listening to that signal. That's what is described as insulin resistance. So you have cells that are no longer listening to the insulin signal. So the pancreas responds by just shouting louder. All right, if you're not going to listen, I'll just produce even more insulin. So now you have people walking around with much higher levels of insulin in their bloodstream than they should normally need to get the same effect of bringing their blood sugar levels down. And why this is problematic is because that insulin resistance is associated with cardiovascular disease. It's associated with weight gain. It's associated with something called metabolic syndrome, which is high blood pressure, high cholesterol, fatty liver, weight gain. So it's that constellation of conditions together is very much rooted in insulin resistance. So what we want to be doing is looking at, from a nutrition perspective, if we're
Hmm.
facing insulin resistance, what can we do to kind of moderate our blood sugar levels so we're not getting these big spikes? Because if we don't have big spikes in blood sugar, then we don't need these big spikes in insulin either. So an approach to eating that's more balanced, that kind of pairs your complex carbohydrates with
Hmm.
protein and with healthy fat, that's going to give more stable blood sugar levels and help that insulin resistance piece. And then you mentioned GLP-1. Well, GLP-1
Yeah.
is another hormone in the body. It's a peptide that's naturally produced by our gut. And GLP-1 helps with the pancreas and helps stimulate appropriate insulin production. So, insulin production that is in response to blood sugar changes. So, that's helpful. The GLP-1 is helpful in bringing blood sugar levels down, but it also acts on the brain and it's a satiety signal, a fullness signal. It's the signal that's like, you've had enough to eat. That's enough nourishment for your body. You can stop now. So, it tries to dial down that appetite so that we stop eating. And so that's kind of one of the benefits that makes these good medications as well, is it really acts on the level of kind of cravings for food as well as the over hunger piece.
And so when they talk about, if you're on GLP-1, you're at risk of muscle and bone loss, what is the rationale for that?
So I think we need to be careful. I would say that that's kind of like media hype of first GLP-1s were like all the rage and every celebrity was taking
Yeah.
them. And it was like, well, let's turn against GLP-1s. They're super
Yeah.
dangerous. They call gastric paresis, all this stuff. So again, it's nuanced, right?
Yeah.
GLP-1s in the right context, i.e. treatment of obesity, which is a difficult disease to treat and associated with a lot of health complications, it may be an appropriate tool to help a patient because the benefits of treatment are going to outweigh any potential risks. GLP-1s used in the context of celebrities and bodybuilders and like endurance athletes to kind of cut that little bit so they can be even leaner, probably you're going to see that the risks outweigh the benefits. So I'll just start like with that premise.
Yeah.
Now, uh, we need to understand that all medications come with some risks. This
Mhm.
concern around muscle and bone loss, I would say, is not one of the main risks of GLP-1 medications whatsoever. In fact, they're more
Okay.
short-term GI upset, like nausea, constipation type side effects that are fairly common but should be mild. When the media talks about concerns of muscle loss, we know that with all weight loss, about 2/3 of the weight lost is fat tissue, and about
Right.
1/3 is lean mass. And lean
Okay.
mass is not just muscle. Lean mass is kind of all non-adipose tissue organ mass. So
Okay.
that's very normal. Whether you do bariatric surgery or you do some, caloric restriction diet, you're going to lose some. GLP-1s are no different from that. They don't preferentially target muscle in any way. They just cause over. People come in and it's purely like an aesthetic weight loss. It's really
Hmm.
not health related. And I believe that the GLP-1 usage is going to cause more risk than benefit. And I'll turn those people away and they're disappointed and angry with me that I'm not that doctor that's just going to prescribe it to everyone.
Right.
But then
Right.
there's the patients who maybe they don't meet the official, Obesity Canada guidelines based on BMI, but they have other clinical reasons that they would benefit from GLP-1 treatment. And then that's a more nuanced discussion with the patient. So it's so individual. I know I'm not giving you a
Right.
straight up
Right.
answer,
No.
but it needs to be that way with each person.
Um, and that brings me to, some of the health benefits that we're hearing more and more in the media around heart health and some other things with GLP-1. What is the actual like added benefit of it? Is it really just for somebody who's kind of in a bad way? that should be thinking about that? Or if you have a pre-diagnosed cardiac condition, is it really an option for you? Kind of
Yeah,
getting off the
absolutely. So
weight
we
loss
can,
track, but
yeah, I mean, we're seeing weight loss is not the ends, right? It's the means to a greater end, which is always health improvement. And that's what we're seeing with these medications is, we suspected that with weight loss, we would see health improvements, but now it's being proven. And it's being proven in a number of areas. You mentioned heart disease. We see it with kidney disease and diabetes. We see it with sleep apnea. We're seeing it in a number of different areas. Even there's investigation into mental health now as well. So this does seem to be a very powerful molecule, this GLP-1 molecule with a lot of different benefits. And that's because there's receptors in all different organ systems in the body for this GLP-1 peptide. Coming back
gotcha.
to your original question around heart disease, we know that quite dramatic improvements are seen, and this is in a high risk population. So we're not talking about, someone who doesn't have any risk of heart disease that they should go on to protect their heart. We don't see
Mhm.
that. That's called primary prevention. We haven't got that data yet, but we do have it for secondary prevention, which is those who have evidence, like we know they've got proven cardiovascular disease. Maybe they've had a previous heart attack or they've had a previous stroke, that starting GLP-1 medication and specifically semaglutide comes with a 20% reduction in future events. So future stroke, future heart attack, future death from a cardiovascular cause. 20% is a huge harm
Yeah.
reduction when we compare that to other medications that we have for that patient population. So these are important medications in that context. And I mean, I think that's the exciting piece, right? I think that these medications have faced a lot of criticism for those who think it's just about, vanity metrics and things like that. And really, as an obesity physician, for me, this is about really changing people's lives, improving their health, reducing their long-term risks, seeing them live healthier and longer. That's really ultimately what matters.
Absolutely. And I think, we talked about being in the gray earlier, but vanity is gray, a bit gray too. And I think we have to be cautious when we decide if somebody's choosing to lose weight because they just want to look good, but would them feeling more confident in their skin result in them being more confident to go to the gym, more confident to get out, have better mental health? I think the way that social media is and grabbing onto these things and villainizing people is just it's a little bit dangerous for people.
Yeah, I think that's a really great point that you're bringing up because, again, going back to the definition, excess adiposity causing impairment to health, function, or quality of life. And who's the judge of if your weight is causing an impairment to your quality of life, right? Like we do live in a culture that still there's a lot of like fat shaming and like we just do, right? That's the world that we're
Yeah,
living in. And so for so
yeah.
many people who have lived in a bigger body and they have experienced kind of like that judgment or stigma, like who are we to say like, well, you're just doing it for vanity? It's like, no, i'm
Hmm.
i'm going to be able to better function in this world. I'm going to be more confident at everything that you just said. I think that's
Yeah.
such an important point. And again, it comes down to good clinical care when we're delivering these medications and treatments and having a good, but then maybe working with a counselor or a therapist on what are some other coping strategies when you're kind of just wanting to have that glass of wine or that bag of chips at nighttime. How else can you support yourself? So all of those things need to be taken in account, plus developing kind of new habits, right? That are going to lead to the most consistent and imperfect, right? I always emphasize that with people. It's not going to be perfect, but how can you be consistent as possible with
Hmm.
living your healthiest lifestyle within the context of like your work life family balance?
I think that's so important. I worry often people think they have to do that change perfectly. And so when it falls off, they sort of give up and stop, or are really hard on themselves. And it takes longer for them to get back on the cycle of doing that habit again. And so if you have this mindset of, it's going to ebb and flow, how good I am at achieving this outcome that I'm supposed to do, but that's okay. I'm just going to be as consistent to do what I can every day. I think it's a really big game changer for people in succeeding and changing their behaviors over the long term.
Absolutely. The all or nothing mindset, I think, is one of the
Yeah.
most
Yeah.
detrimental, right? I deal with it every day with my patients and the women in my coaching program. It's really breaking that down, getting rid of perfectionism and looking at, okay, like I'm just going to make my next best choice right now. And really that principle of like 1% incremental change, getting rid of the idea that it's like it has to be an overhaul overnight of everything. And that just creates overwhelm. And that whole thing that you just mentioned of if I don't get it perfect, I just might as well quit, right? It's so damaging to the idea of I can just work on little changes that seem almost too simple and then build
Hmm.
on that and then get the compound interest, like the compounding returns of the consistency of little habits that you're shifting.
Yeah. And I mean, and we know as it relates to exercise, if you just tell yourself it just 10 minutes, that once that 10 minutes
Yeah.
is done, your brain will actually switch over and you'll want to keep doing it. So just figuring out some little tricks. Because saying I just have to move for 5 minutes, that, can get you off the couch. But saying, okay, I need to go for a 45-minute walk or hit the gym is like, no, I'll just stay here.
Exactly. Exactly.
Yeah.
Yeah.
And so what would you say are some of the biggest myths or things you wish that you could just erase from women's discourse or things that you hear as it relates to weight?
Think one of the things, especially for kind of this menopause transition stage, is that weight gain's just inevitable, right? Like there's this kind of mentality of like my body is betraying me, that sense, right? Like I don't know what happened, I haven't changed anything, but my body's shifting. A lot of women feel that way, and it feels kind of very helpless or out of control. And our bodies do change. And I think that there needs to be like a little bit of cultural acceptance around the fact that we do change, we get wrinkles, maybe some gray hairs, right? Like all that stuff
Hmm.
that happens as we age. And yet we can still be the healthiest version of ourselves with each decade that comes. It just might look a little bit different, right? But
Hmm.
it requires kind of that intentionality and that idea of working with our bodies instead of fighting against our bodies that I see so often with the women that I work with, and that it changes, right? So the things that you could get away with, or maybe that worked when you were 20 and 30, like you kind of eat whatever you
Hmm.
want and then cut calories for a couple weeks and you get back to your skinny jeans, right?
Yeah.
Like that works when you're younger. It does not work when
Yeah.
you're in your 40s and 50s and beyond. Right?
Yeah.
It's going to look a little bit different. And maybe the amount of alcohol that you were able to drink when you were younger, that doesn't work so much anymore, right? So there's shifts that need to happen, but we can still support our bodies as we get older and as we go through these changes.
Yeah. It just starts to look a little bit different.
Yeah.
Well, and I think too, I mean, if you can remember when you were in puberty, that transition as your hips started to develop and things kind of shifted, it was likely an uncomfortable period in your skin. I mean, with everything going on, and that took time to sort of settle into and understand what was happening. And so it's kind of just another big transition period for the physical body.
Yeah, yeah, exactly. And I think if I could add one other thing that I just thought of is I see so many women chasing I like to call them like the sexy things, right? The things that seem really complicated and like you have to do this specific combination of supplements and then you have to
Mm,
combine your macros just like this. And it's so overly complicated, or time it to your menstrual cycle and like all this stuff. And they just forgo doing the basic, boring, consistent day in, day out, like just meal plan, just get some protein and
I
veg,
know,
like
I know,
complex carb. It's so
I
simple.
know.
Get some
It's
sleep.
so simple.
It's
Yeah,
really simple, and people they're just chasing like that thing that's really flashy and shiny. And that's what like why diets are so attractive, right? Because it seems like there's a
yeah,
secret formula that you just need to tap into. And if you just tap into that, then it'll all
yeah.
work, as opposed to like, no, I think you just got to do like the basic things that you don't really feel like doing each day, but you kind of stick with them. And over time, if you kind of stick with them in the long term, you'll be better off and your health will be better off.
Well, I love that you said that so much because I absolutely watch and see, people rally and try to get the latest supplement or the latest this. And they want a quick fix too. So I think it's both like we
Yeah.
like new things, but we want a quick fix. And so
Yeah.
it is the basics. And sometimes I get questions like, should I buy creatine? And, the response back is, if your basics are foundationally consistent and strong and you're getting the right amount of protein, hydration, sleep, like for sure, like let's consider some supplements and things like that. But very rarely, like starting to take the creatine is not going to improve your muscle mass without
Yeah.
in the absence of doing the strength training and
Yes.
doing this the sleep and the hydration and the protein.
Yeah.
And so I think it's hard. Like it is, well, the plan is simple. It is hard to make that decision of I'm going to let go of those old bad habits and really start to invest in consistently prioritizing my health in the way I eat.
Yeah.
Like,
Yeah.
what makes it so hard for us we know it's good. We know we're going to feel good. What makes it so hard for us as human beings?
That saying that the urgent takes the place of the important, right? It's like it's kind of that. It's like your health, when you have it, your health can be
Yeah.
left on the back burner. And it's like not until a crisis hits and someone's diagnosed with heart disease or diabetes or what, God forbid, that they're like, oh my goodness, I've completely neglected it. Or sometimes
Yeah.
I'll hear like, it just came out of nowhere, right? And it's like, well, it didn't really
Mhm.
actually. Like usually we can look back at like decades of, you
Mhm.
know, of not caring for yourself. And it's not a judgment or like, I don't want anyone to hear
No,
this and like feel criticized, but it's like,
no.
it's so easy because we do have other competing priorities and we live in a culture that's too busy, right? We just get
Mhm.
too busy, we get distracted with other things, career, money, status, keeping up with the Joneses, all of those other things that vie for our attention. And doing those simple things of like, let's move our bodies and let's go to sleep
Mhm.
instead of scrolling on Instagram
Mhm.
tonight. Those
Mhm.
things just kind of are not priority until it's forced upon people often. And
Yeah,
I would just hope that, like, let's turn that around, right? Like, let's be
I know.
intentional early because there's so many benefits to it, right? Most people would say, if you ask, like, do you want to spend your retirement in and out of hospital and like doctor's visits, or you want to spend your retirement traveling the world and being with your grandkids? Right? Like, it's easy. It's an easy
Yeah.
answer there.
Yeah.
But are we living that way? Are we caring for ourselves in a way that's going to lend to that? That's another question to ask ourselves and just to
Yeah.
reflect upon. And then
Mm.
from there, and I just want to say this because I want to come back to like this is not about us feeling bad. This is
No.
if someone's listening and they haven't been intentional, then our encouragement is just saying, hey, it just takes you reflecting on like, well, what's one little change I could make today? What's one little way I can support my body today? And that's
100%. And this is all about just evolving in a positive direction every day. Um, And certainly nobody is perfect. This is human nature,
yeah.
that we're like this. So, yeah. Well, thank you so much for your time.
Yeah, thanks so much for having me. This was great. Great conversation with you. And I know we're so
Hopefully,
aligned, right, in some of our philosophies towards health. So, really great.
absolutely.